Hello, welcome. My name is Umair Karim, and today we will be discussing artificial intelligence, healthcare industry, and hospitals. Okay, to get a little background, uh, the healthcare system has its pros and cons, and many people will judge the situation based on their personal experiences. So, private hospitals offer extra services and extra expertise to their clients compared to the public hospitals. Also, the public hospitals serve more uninsured people than the private hospitals, um, which would mean that their minimal funds are extremely stretched out. Many countries, such as Canada and UAE, citizens have insurances from birth. In UAE, the health insurance free of charge for life. In America, we run things a little differently. So, luckily, in America, the healthcare has excelled. More cures and treatments are available. However, when you visit hospitals, you're not always given the treatment you deserve. I say that because your hospital treatment varies based on your skin color, insurance provider, and other traits like other traits displayed. For example, colored women are more likely to die during childbirth because of doctors' negligence than natural causes. A friend of mine did not have insurance, and once the nurse realized that they weren't as catering to him, this is his experience. That I was made aware of. As they were, this was compared to when he originally got in and Traj, where to the treatments was different. It changed. So it goes to show that the importance of having a good health insurance. So although hospitals try their best to provide good services to their patients, they are not able to cut down the billing amounts. Patients are still charged enormous amount of money for their treatments. From my personal experience, I was one time I had actually really high fever. Um, it was for like really a couple of days, and it wasn't going down, so I had to go to ER. They gave me Tylenol, two Tylenols, and they charged me $25 for Tylenol. I was giving it was just to reduce the fever. Other patients are enduring these high bills, and they find it a lot of time they face financial hardship. Paying these bills back to the hospitals. There needs to be better services provided to eliminate and eliminate the personal biases when providing treatments. The bills charged to patients must be related to their treatments. Often the charges are not related to their treatments that they're provided or the treatments that the patients receive. So, despite the hospitals doing their best to provide the best treatments for their patients, there has to be some type of accounting system put in place to understand how the funds are being dispersed. Meaning, how much is the cost per patient for a particular treatment? Yes, not every patient is receiving something genetic, but there has to be a minimum cost associated with a specific treatment. Otherwise, the hospitals would be operating in dark. They are they are treating patients without knowing how long they can financially continue to do so. My reasoning for that is. Uh, Not every patient will have the insurance, and not every patient will be able to pay their bills. In my opinion, this is where artificial intelligence will help the hospitals run their numbers and have certain data run to paint a picture for the management of the hospital. Uh, and the to take an example, the veteran affairs hospitals keep large amounts of individual medical data. Individuals like the people, the veterans, the medical data, to be able to refer back to it, and if they need it, as they implement analysis to predict possible future illnesses, and to be aware of the patient's history. The centralized data analysis division has uh, created and deployed across the veteran VA hospitals for the additional top layer of the decision making and implementation of the implementing the system wide to run the data through through the system wide through their whole system. Every hospital has to have some sort of analytics where the cost evaluation and the cost management are analyzed. The value driven outcomes model is an activity based cost accounting that defined exact cost per patient. Not just for patient, but also for per treatment, and it evaluates a cost effectiveness analysis between cost and treatment. More hospitals have to implement such models. So the value drive in the outcome model develop viable and accurate matrix identifying the exact cost, measuring exact cost, and evaluative analysis of cost effectiveness per treatment. It had the ability to quantify answers to the cost of lower quantity, high quantity, effective quantity treatment. The value-driven outcome defines answers to costs and treatments variance. All right, so the variance by equipment utilized, the patient care quality, and the overutilized causes of low to no quality care added, and now reduced by the value driven outcome. All right, so the patient data is stored for future references. It is in modern world, everything from our phones, our computers, all the data is always bought and sold and bought. Similarly, the patient's the same data, the stored for even though it's stored for the future references, but it's also sold and bought for various reasons in medical field as well. Medical monitoring devices and wearables tracking individual health collect all available sensitive personal medical data. And obviously everything is stored on these hard drives and what's the word I'm looking for, servers. So the analytical tools have client and provider facing models actively evaluating and recommending earlier medical interventions for physicians and the hospital awareness. So the devices are tracking patient medical factors, demographics, medicine, health outcome, and much more. Insurance is like I believe it's the healthways, not I believe it's the not I believe, but rather the health insurance like healthways. They utilize the data from their own devices, their servers, and they also utilize the data from their competitors, their devices, to get the to manage the cost and come up with new features into ensuring patients are cured and not a universal treatments that will help everybody. That it's rather individualized care, which is required and is very much important. I'm not a doctor, but doctors have to understand the medical history of the individual and come up with a treatment plan that better suit them. Ensuring sensitive medical records are secure, and it's very important for a long-term concern. Uh, for the patients and the insurance companies as well. So exact cost and cost contributors are now known. The hospitals will become more cost effective without knowing the cost of service. The hospital is operating blindly. Management has to and dictate rules and goal quotes to allow um, whatever the allowable cost the lines are. Public hospitals are required to serve all patients, right? And having cost sensitivity shaping treatments plans. That would lead to inferior quality care. So, to conclude our presentation, uh, artificial intelligence technology that is being applied in public and private hospital system could greatly benefit the public, as well as the taxpayers, right, and shareholders, and most importantly, the the health outcomes in the population. Uh, for example, as I mentioned before, to utilize the previous data to determine, predict possible illnesses and possible cures. Um, Improving the managerial process in cost management could lead to decreased treatment costs in an efficient free market for paid healthcare. And this concludes our presentation. I thank you very much for your time.